Hi, my name is Dr. Angela Moreland with the National Crime Victims Research and Treatment Center at the Medical University of South Carolina. Today I'm going to talk about symptoms of grief and how they really can be heightened during this COVID-19 pandemic and the related quarantine that's going along with it. So when we think about typical symptoms of grief, a lot of these symptoms can include increased irritability, sadness and crying, numbness, isolating ourselves from other people, or loss of interest in activities that we used to enjoy, change in appetite, and also sleep problems, which can mean difficulty falling asleep, or also can mean waking up in the middle of the night with feelings of grief or feelings of fear. So people experience different symptoms of grief, and they experience them at a different timeline. So one person may be experiencing some things, and someone else may experience grief very differently. And that also can change depending on how long or how recent the traumatic experience or the death has been. One important thing to remember is that stress really can heighten symptoms of grief and can cause additional triggers. So the stressor that we're going through right now, being COVID-19, and all of the factors that go along with it. So being quarantined and isolated, not having as much social contact with loved ones, worrying about working from home, family members being at home, kids needing to do homeschooling, and potentially loved ones being essential workers and being out in the community where we worry about their safety and the safety of ourselves. So having those stressors really can heighten grief symptoms that were already there. So if someone is experiencing grief symptoms, maybe due to a recent death of a loved one, or even if it has been a long time, if they're still experiencing symptoms and then this stress, which we'll call cumulative stress, piles on top of that, then those symptoms can really increase and be heightened and can seem a little bit less manageable than they usually do. Something else that's also really important to think about is even if your symptoms of grief have decreased a lot. So say you're doing much better, whether that be over time or just through your own healing and your own coping, through seeing therapy, through support groups, whatever mechanisms have been helpful for you in the past, maybe you're not experiencing a lot of those grief symptoms right now. What can happen though is when a major stressor comes about, like what's happening right now in our communities and in our country and in the world, it can add on and bring back some of those grief symptoms that we maybe haven't felt in a long time. And that can be confusing and scary because what's happening now may not seem at all related to what happened with your loved one or to what happened in your traumatic experience. However, that stress can trigger some of those same feelings and they can come back. So it's very important to remember that during times like this, where we have additional traumas and we have additional stressors, we need to think about that grief. And when that grief does come back and when some of those symptoms do come back, we need to take care of them just like we would following the death of a loved one. So what can we do in this situation? A major thing to do is use some of the same skills that have worked in the past. So whether you used breathing, whether you used support, therapy, whatever those things that were helpful for you to deal with grief symptoms in the past, those can be used now to help address some of the symptoms that are coming back or coming up because of this stressful experience. Also, just really try to decrease stress. So I know that's easier said than done, but limit media exposure. Seek support, talk to people, reach out if you need help, and also really engage in self-care. So do things for yourself and try to take care of yourself. This is a really hard time, and it's important to remind ourselves that we will get through this and that the healing process can look much like it is with initial grief or with grief over time. So do some of those same things to reach out and really pay attention to those symptoms that come up and give ourselves a little bit of relief and a little bit of grace for that and know that these symptoms will pass. We just really need to pay attention to them and engage in some self-care and really reach out for support when we need it. Thank you.